A very good evening and a warm welcome to all our viewers. I am Dr. Innati, a member of the clinical engagement team at Plexus. Thank you all of you for being a part of our glorious 8 year celebration. I hope we are able to add some clinical insights to your knowledge and we are able to give you something new. Plexus Essentials is one of our many interesting activities that we have been carrying out as a part of our 8xc program. I hope all of you are enjoying the series and we have done the last two lectures on medical legal aspects of autopsy and other issues. Now today we are going to talk about dealing with difficult patients. Difficult patients evoke strong negative emotions from their physicians. If not managed correctly, such patients can lead to diagnostic errors, troublesome complaints, or legal claims. Good rapport and communications can help resolve these issues tactfully. Patient encounters can be turned successful with a good knowledge of the relevant literature in this field. To talk more on this topic, we have our eminent speaker today, Dr. Kunal Sethi. Dr. Kunal Sethi, after completing his BDS and MDS from Rajiv Gandhi University, Bangalore, is currently an assistant professor at guide at MGV Dental College and Hospital, Nasik. He has done his PG diploma in medical legal systems, and since past 15 years, he has been doing pioneering work in the field of medical legal aspects for doctors. He has been helping a lot of doctors in resolving issues which pertains to patients and their complaints and their issues against the doctors. He was speaker at Cross Connect conference in 2017 and 18, where various issues of medical laws in Kolkata were discussed. He has done and participated in many such conferences and also presents a lot of cases on behalf of the doctors in the court. He is also a medical legal reporter and a medical legal advisor. He has published many books on the topic of Consumer Protection Act and doctors, which is a burning issue in today's time. He has also participated in a lot of training activities and keeps consulting a lot of doctors in terms of how to deal with patients in a better way and how to document things properly. It's an honor to have you here today, sir. Requesting you to please start your presentation.
Very good evening to one and all. First of all, I would like to congratulate Doc Plexus on achieving their milestone in connecting with doctors and giving 8 years of education to doctors through this digital platform. Myself, Dr. Kunal Sethi, and today I would be speaking on dealing with difficult patient. With special focus on patient's consent and record keeping and the medical legal aspects of this topic. So this is a small brief introduction about myself. I've been working on this topic since the past 15 years through numerous medical legal journals and books, and this is a topic which needs a lot of attention and education. And I thank once again Dr. Plexus for bringing this topic into limelight so that doctors of different specialities can come and take knowledge about this topic. So coming to today's topic, before we go in depth on patient's consent and record keeping, let us have a brief introduction about what exactly is this topic, medical legal aspects of practice, all about. So medical legal, if you see the dictionary, it is a term which incorporates the two basics of two sister profession, that is medicine and law. So it is combination of some part of medical practice and some part of legal practice. And this synergy which comes together, which is applicable to practicing doctors as well as lawyers, that is summarized in this terminology of medical legal. So these two professions are the pillars of our society. But unfortunately, both these professionals, they suffer from ignorance of each other. That is, doctors are not aware of the legal provisions applicable to them. And the lawyers, of course, have very less idea of the medical part. And therefore, this third specialty of medical legal practice has come up, in which there are experts who have knowledge of both the professions, and they can guide doctors in cases of litigations. Now, what is a medico-legal case? So, medico-legal case can be defined as a case of injury or ailment in which investigations by the law enforcing agencies are essential to fix the responsibility regarding the causation of the injury or ailment. So, whenever a case is reported to a doctor or a hospital, if the doctor feels that there is something fishy, there is something wrong, he is not satisfied with the patient's version, and he feels that he needs to report this case to the legal authorities to find out the exact cause of injury or death or ailment. In that case, when the legal authorities come into action, that case can be broadly defined as a medico-legal case. Now, how does a doctor receive a medico-legal case? A medico-legal case can come to a hospital, a clinic, or a doctor by the following ways. The first one is when a case is brought by the police for examination and reporting. So if the police officer comes to a hospital or a doctor for their help in finding out the cause of death or the cause of injury, that is one way of receiving a medico-legal case. Second, after examining the patient, if the doctor feels some investigation by law enforcement agencies is required to fix responsibility as per the existing law. So this is the second way where the doctor or the health authorities approach the police and inform them that they need to investigate this matter. That is the second example of medico-legal case. Third one is when patient himself desires to register a case against the doctor. So this is the point which we'll be discussing in detail today. That is a case of medical negligence where the patient is not happy with the services he has received from a doctor, and he goes to the court and files a case against the doctor. So that is also a medico-legal case, and that unfortunately is one of the most commonest ways of receiving a medico-legal case. So this is the burning issue. This is the elephant in the room which has to be addressed. And the last point is when a medico-legal case is already filed elsewhere and a doctor is called as expert witness. So with the number of cases rising against the medical fraternity, many a times specialist doctors are also called to the court by the consumer courts to seek their expertise, to take their opinion whether there was actual negligence which has happened in a particular case. So such doctors who are called as witness, they are called as expert witness. And this is also how a doctor can receive a medico-legal case. So moving on. Of late, we are seeing a phenomenal rise in the number of cases against doctors, and there are multiple reasons for this. First one being patient relationship. So a few decades ago, the nature of doctor-patient relationship was a closer one. It was an informal one where the family doctor was actually considered as the part of family, and there was healthy interaction between doctor and patient. But in the past few years, because of the changing nature of doctor-patient relationship, now it is seen as a mere contract where the patient pays the doctor for services. And if they do not get the required results, then they go to the court because they feel it is the violation of a contract. Second point is commercialization in healthcare industry. So of late, there have been a lot of corporatization of the healthcare facility, and a lot of private hospitals have come into many cities, not only metros, but also tier 2, tier 3 cities. And because of this, there is a lot of fierce competition, commercialization of healthcare industry to increase in the number of cases being filed against doctors. Perceptible decline in medical ethics. So unfortunately, a few bad apples can spoil the name of the entire fraternity. So there has been noticeable